Hello, we are talking about psoriasis. What is psoriasis? Psoriasis is a common chronic immune mediated inflammatory condition in which multiple genetic factors, environmental factors lead to formation of erythematous plaques with silvery white scales. Okay, so it is a dermatological condition in which there is increased keratinocyte turnover. So it normally takes 30 days for a basal keratinocyte to reach the surface, but in patient with psoriasis it is reduced to 4 to 5 days. In this video we will be discussing mainly the signs of psoriasis. So first we will be discussing the auspit sign. For auspit sign we perform 3 simple steps like take a glass slide and rub the scaly scale, that is called guttate test. After rubbing with the slide, scales become very prominent, and when we tend to remove these scales they come out in a one go, that is called candle grease sign. After removing the scales we can see a thin glistening membrane called as berkley membrane, and after removing this membrane, pinpoint bleeding spots which are seen in the image. So these are because of suprapapillary thinning. In this diagram we see like a patient presented with itchy scalp and dandruff, and the auspit sign was positive. So this is basically a case of psoriasis, and there is a point to note here, like psoriasis involve extensor surfaces, not the flexure surfaces. The psoriasis which involves flexure surfaces is called as inverse psoriasis. So we will discuss that also. In this image we see classic psoriatic arthritis, which typically involves a distal interphalangeal joint. So psoriatic arthritis refers to inflammatory musculoskeletal disease that has both autoimmune and autoinflammatory features, characteristically occurring in individual with psoriasis. So point to be noted here is that asymmetric oligoarthritis is the most common type of psoriatic arthritis. This is camel foot appearance, which is seen in histopathology of plague type psoriasis. So I want to discuss more about it. Normally what we see, like 10% of basal cells are in proliferative stage. Okay, whereas in psoriasis about 90% of the basal cells are in this phase. As a result, to accommodate the increasing population of basal cells, retapegs take a plunge into the dermis in form of elongation of reterages, which is called as giving appearance of a camel foot. So this is another image. So basically we see irregular epidermal thickening, which is called acanthosis, hyperkeratosis or parakeratosis, suprapapillary thinning, clubbing, Kogo's spongiform pustules, Monroe's microabscess, absence of stratum, granulosum, dilated tortuous blood vessels in the dermis, suprapapillary mononuclear leukocyte infiltrate. These all are histopathological findings of psoriasis. So in this model presents to OPD with cutaneous lesions. She informed a metallurgist that these lesions increase in size and whenever she consumes alcohol, and they bleed whenever she scratches them. So this is basically psoriasis. So next come the nail changes in psoriasis. Nail changes, as we see, first is deep and coarse nail pitting. It is most frequent sign, which is also called most common sign. Then come oil drop sign, which is also called as salmon patch, and it is highly specific pathognomic sign. Then onycholysis can also be seen, and longitudinal ridging can also be seen. Next come leukonychia. Leukonychia is like whitening which is seen in middle of the nails, so it may also be present. Then this is the case of pustular psoriasis, and oral retinoids is the treatment of choice in this, acitretin, etc. Then comes our classic sign like DIP are involved, joints are involved. So this is basically psoriasis with arthritis. So methotrexate is the treatment of choice in this. It is also a common image of psoriasis, erythematous plaque with white silvery scales. Then comes rheumatoid psoriasis. This is basically a worsening psoriasis whenever a patient takes like any drug which exaggerate the psoriasis, like valproic acid, etc., or any lithium, etc. So maybe it is basically after valproic acid. So any drug which worsens psoriasis. Then comes guttate psoriasis. It is also a type of psoriasis which occur as sudden onset shower of small lesions which is seen all over the trunk and arms after attack of pharyngitis. So this is guttate psoriasis. These are small red drop like lesions. Okay. This is also an image of psoriasis, erythematous base with silvery plaques, and greatest as positive aspect sign seen. Then next comes pustular psoriasis. So this is basically after treatment with steroids, and on stoppage of treatment the patient develop fever, malaise and lesions like this. So basically we prefer topical steroid, not oral steroids, and this is the condition what happens if we give oral steroids in a psoriatic patient. The last image I want to discuss is inverse psoriasis. In this, flexural plaques are thin and scaling is greatly reduced or absent. So it involves inguinal creases, axilla, submammary folds, gluteal cleft, umbilicus and other body folds. So it is more common in older adults and is associated with obesity. Thank you so much for listening.